tell you a little bit about St. Vincent and the Grenadines. It's 32 islands and keys in the Eastern Caribbean Sea, 100 miles west of the island of Barbados, south of St. Lucia, and northeast of Grenada. The main island, St. Vincent, is mostly volcanic, with a central chain of mountain peaks and ravines. The highest mountain peak is an active volcano called La Soufriere, occupying most of the northern segments of the island, and is said to be one of the most active volcanoes on Earth, with 5 eruptions since 1718. Here in St. Vincent, there's a picture of our capital, Kingstown, and persons celebrating Independence Day. This country has a population of over 100,000 people, according to the census in 2018. Just to give you an overview of the volcanic eruption in 2021. On December 2020, scientists from the University of the West Indies Seismic Research Center, UWISRC, increased monitoring of the volcano when it was detected that a new lava dome was progressively growing as an effusive eruption, that is, a slow and steady lava flow. Local officials began to reach out to residents in the volcano immediate areas or the red zone to update and review plans. By this time, COVID-19 cases had increased significantly. 3 months before, there was an outbreak in dengue. Overview of the volcanic eruption 2021 continues. The Ministry of Health, Wellness and Environment, along with various sectors of the government and other officials, had to deal with triple assault. That is to say, the ongoing pandemic of COVID-19, the outbreak of dengue, and an erupting volcano. And this means that it will cause like a potential to drive up the cases of COVID-19 just because there's a likelihood of persons evacuating to shelters and other private homes. Hence, will cause the problem for people violating protocols implemented for COVID prevention. But on the other hand, mask wearing now serves 2 purposes, which is to prevent COVID and to prevent the inhalations of ash. On the 8th of April 2021 at 4 p.m., the Prime Minister, Dr. Rob Gonsalves, issued an order by the social medias, by the radios, the television, that the country that is located on the red zone to be evacuated. And at that time, over 20,000 individuals evacuated due to an impending explosive eruption, which is more dangerous than the effusion eruption that was happening before. On the 9th April 2021, the next day, La Soufriere volcano had its first explosive eruption, sending ash approximately 32,000 feet into the air. Since that time until the 20th of April, the UWISRC recorded 30 of those explosive events. 2 weeks later, on the 6th of May 2021, the alert level was removed from red, which is the emergency codes, red to orange. But then heavy rains began, where the scientists call it an acid rain. This sent mud and volcano ash. The volcano ash is referred to as lava, and boulders as big as 15 feet in diameter rolling down from the sides of the mountain of the volcano. Lucky the evacuation happened the day before. While no deaths or injuries were reported, the country was left covered in gritty and destructive volcanic ash. Now, the Modern Medical and Diagnostic Center in which I work has its location lying in the heart of the volcanic affected area, the red zone, right? It is a government-owned facility, and this facility was open since the 2nd of July 2018. It houses the newly operated oncology unit. During the volcano eruption on the 9th of April and 2 months after, the oncology unit remained closed, while the Ministry of Health relocated the staff members of the unit to the main hospital in the capital of Kingston to the general wards. The patients and clients weren't able to receive chemotherapy through the government system due to this, but they were able to receive consultation by the oncologist on the Tuesdays at the General Hospital. 28 oncology patients living in the red zone evacuated to shelters and private homes in the yellow and green zones, which was considered the safe zones. 8 of the 11 oncology staff evacuated their homes with their families as well. To this day, clients and staff still grappling with the effects of the COVID-19 pandemic. They experiencing the financial, emotional, physical, and mental stress. COVID-19 now saw the introduction of our new normal as a prerequisite for entering any ward, as a matter of fact, including oncology, where the antigen swabbing of all patients prior to entering, mandatory wearing of face masks, social distancing, sanitizing, and hand washing protocols. Statistics, Oncology, Hematology Department. Now, since the inception of the Modern Medical and Diagnostic Center in July 2018 to September 2021, the oncology unit has administered 444 cycles of chemotherapy treatment to 85 clients. 37 or 43.5% clients completed chemotherapy successfully. 27 or 31.8% clients died. 12 of the total deaths occurred during and just after the eruption. Just before the eruption of the volcano, 19 clients were on the waiting list, either to continue treatment or start treatment. To date, 42 clients are on the waiting list for chemotherapy. Either they presently receiving chemotherapy or they are just on the list for chemotherapy. 24 or 57% actively receiving chemotherapy. There are no known cases of oncology clients or patients receiving chemotherapy died of COVID-19 virus. Since the services at the Modern Medical Diagnostics Center restarted 3.5 months later since the eruption that was in the middle of July, the oncology was unable to restart the chemotherapy because they had to reorganize the clinical area, follow up with clients, awaiting laboratory investigation of clients who is eligible for chemotherapy, and the yearly mandatory inspection and certification of the biohazard cabinet was also delayed so that the pharmacists and all the technicians could mix the drugs. Right? The inspection and certification of the biohazard cabinet was then interrupted by several reasons. The person who was qualified for this is based in Trinidad, and at the same time, They could not come to St. Vincent because there was a lockdown of borders due to the rise in COVID-19 in Trinidad. But then when the volcanic erupted, there were heavy ashfall in the Vincentian airspace. That is the ashfall around St. Vincent and the Grenadines, Barbados, and surrounding areas. The 12 clients who died during and after the volcano eruption would have died because they were unable to afford chemotherapy at private institutions in the meantime. Some clients refused therapy even before and after we started to function. There were late diagnoses. Some persons came to us too late, and there was unavailability of the appropriate chemotherapy drugs as well. Majority of the clients decided to wait until the modern medical diagnostic center reopened to restart chemotherapy. A few were able to afford one or two therapies privately. And of course, this was very expensive to do. Hence the reason why majority of the clients decided to wait until the government facility was reopened and restarted. Some clients at the same time, while waiting, their conditions deteriorated. Others found natural methods, hoping it would aid in healing, and they will come occasionally to do lab works. According to the pharmacy department, some chemo drugs expired or are near expiry date due to the delay in therapy. And this delay in therapy was caused from the volcano eruption, of course, and some clients became too ill for therapy. In hindsight, the updates given by the UWISRC's temporary plans should have been, this is my personal opinion as a nurse working in an oncology unit. The temporary plan should have been in place for relocation of the oncology unit so the clients could have their treatment on time. So this would alleviate suffering and improve their quality of life. Despite the difficult circumstances in the aftermath of the volcanic eruption and concomitant COVID-19 outbreak, oncology nurses continue to provide the optimal patient care even when relocated to the general wards. There is no doubt that the Ministry of Health, Wellness and Environment was challenged to manage two health crises simultaneously and called upon the health workforce to respond and adapt. The oncology nurses remain in place despite significant personal and professional stressors as cancer treatment becomes available now in the public sector. We are delivering the highest quality nursing care to our patients and family as they deserve.